Corlin. Minister, as you are aware, 90% of all deaths due to COVID are aged over 65. All my questions today will be COVID related. The Health Protection Surveillance Centre issued guidance for immediate implementation, saying that surgical masks should be worn by healthcare workers when providing care within 2 metres of a patient, irrespective of the COVID status. Minister, my call and my question to you is, do you agree that this should also be the case for home care workers who will see a number of different people every day, maybe up to 6? Most people receiving home care will be older or more likely to have an underlying health condition, and I've been contacted by very many home care workers who are concerned. So that's the first question. My second question, Minister, it isn't exactly your remit, but I believe you will certainly have influence in relation to this as it affects the care of those cocooning during COVID. While I appreciate we are coming into the summer months and there would not normally be a need for the fuel allowance at this time of the year, we are in exceptional times. Older people are being asked to cocoon and are therefore unable to leave their homes, which is having a knock-on effect of their fuel usage. They cannot walk outside their home, visit libraries, visit daycare centres. And I do appreciate the scheme has already been extended for 4 weeks, but it's due to expire on the 8th of May. And Minister, I'm wondering, could you use your influence that this could be extended again? Because when you're cocooning and you're not mobile, you can feel very, very cold. My next question is in relation to nursing homes. The situation in nursing homes and care homes remains in need of urgent attention. Almost 1/3 of nursing homes in Ireland have the COVID-19 virus, according to the Health Information and Quality Authority. The agreement between the HSE and unions for health staff to be diverted to private nursing homes where needed must be implemented urgently. Minister, I raised this 2 weeks ago. There still is issues around insurance indemnity. And I know it's been moving on, but it's dragging and it's causing a huge issue in relation to staffing. Minister, can I just, I appreciate testing has ramped up in nursing homes since last week, and as you stated, 28,000 samples taken to date. So there was 2 issues in nursing home, PPE and staffing. PPE, I have to acknowledge, has improved significantly in many nursing homes that I have spoken to, but they still have huge issues in relation to staffing. So my question is, Minister, you have tested 28,000 samples. It's imperative now that the test results are accelerated also, because when staff members have to isolate for 14 days while waiting for a test result, it's putting huge influence, it's putting huge pressure on the staffing numbers. And my final question, Minister, is in relation to the situation in Carrick, where asylum seekers are located. And my question is in relation to public health grounds. I believe, according to RTE News last night, there was 22 confirmed cases. The fear and anxiety expressed by the residents pleading to be removed from fear of catching the virus was intense. The locked gates was a terrible image, and also the worry, the anxiety that has caused for residents and businesses. So, Minister, could we have an update, please? Gaurav Mahagut.
Answer them all, maybe you might correspond.
So I'll send a written note on the last one. I imagine it may come up in conversations here anyway. Look, on the issue of home care workers PPE and nursing home PPE, Deputy Butler, over the last 7 days, 6.63 million items of PPE have been delivered across the health service. That's from the 23rd of April to the 29th of April. 54% of this volume was delivered to community residential facilities. That's a total of 1,767 individual deliveries. The full distribution is as follows. 54%, as I said, went there. 8% did go, though, to home care. And I had a very good meeting yesterday with HCCI, who represent many home care providers across the country. We've put in place a direct contact point for them with the HSE, a national director. And they've also brought forward some other suggestions that I'm working the way through in terms of their own provision. So yes, home care workers are now being provided 8% of our entire PPE. That's 497,384 items of PPE over the course of the last week went to home care. But we want to continue to do better and to do more on this. I think it's a fair point. On the fuel allowance, I'm going to resist speculating in departments that are beyond my remit, but I'll certainly pass on your comments to the Minister for Social Protection. In relation to nursing homes, look, you're right. I mean, there's a voluntary redeployment scheme in place. I've seen figures of over 200 HSE occasions to private nursing homes. That's good. It's well up from when I was last in this House, where I think the figure was about 61. So I welcome that. We have now reached an agreement with home care providers as well to redeploy, and that indemnity issue has now been ironed out, and there was an agreement reached about 48 hours ago, so I'd expect to see a benefit from that shortly. The funding scheme which there was a bit of back and forth with Nursing Homes Ireland and my department. Clarifications have been issued. The deadline is today, the 30th of April anyway, whenever that is. The deadline is now, so there's a surge of applications coming in. We're turning them around quite quickly within 24 to 48 hours. That will also help our nursing homes. And the testing. Yeah, you are right. I mean, there was an occasion where there were over 900 nursing home staff out awaiting various tests or with symptoms. What we're trying to do in testing people and getting the results back quickly is most of them will be negative and then we'll be able to go back to work. So yes, I think we can help nursing homes through the quick testing, through the directory deployment, through the home care workers scheme and through the funding scheme as well. Thank you.